somebody had their gallbladder out. All right, this is a common issue, which gives pain. This is Mari, I think, if I say that right. Pain in the arm. So that's a good question. So chronic gallbladder disease can be, again, a vexing problem. And even though you have your gallbladder out, you can still have chronic pain in the area. So one of the things that happens with a gallbladder surgery is you create scarring. The scarring happens in the area of the surgery itself, and that scarring can cause problems with the bowel that's next to it, can cause problems with the liver that's next to it, and can cause problems with the bile duct that's next to it. Also, there could be other reasons for having the pain. The other thing that happens when you remove your gallbladder is you can't produce concentrated bile. And then that causes problems with digestion. And many people who have their gallbladder out need to take bile supplements to be able to help them to digest fats better. So if there's pain in the area here that causes a reflex problem with pain in the shoulder, that may need to be looked at by somebody who basically does like reflexology. But pain in the body where it's felt is not always where the problem is. So you could use PEMF therapy in the area of the pain, in the area of the gallbladder, to see if that would resolve that problem and the pain in the arm. I assume it's the right arm that has the pain. But that's what I would do. You can, if you're having gallbladder problems, gallbladder disease is caused by inflammation in the gallbladder. And when you have inflammation in the gallbladder and you don't have enough, if you're not hydrated enough, then you develop crystals, cholesterol crystals that deposit in the walls of the gallbladder. That causes a gallbladder inflammation. Now, if you have gallstones, that happens over a long period of time, they break off and actually form sludge in the gallbladder, which then can concentrate again and cause gallstones. So gallstones are a problem because they're very hard to get rid of once you develop them. But if you're having gallbladder sludge or you're having gallbladder pain issues, then I would treat with a magnetic field over the gallbladder. You might be able to get away with a lower intensity system like a portable micropulse or a flex pulse over that area, or you may need a higher intensity magnetic field system to help you with that. So I would start with magnetic field therapy and see if that helps with the problem. So related to that, from a holistic perspective, is that if you're not eating fat, if you have your gallbladder and you're not hydrated adequately and you have some gallbladder issues, but you don't have gallstones, then you need to be eating fat, because fat causes the gallbladder to contract, which then releases the bile out of the gallbladder. But the longer the bile sits in the gallbladder from the liver, the bile sits from the liver, it concentrates it. The longer it sits there, the more likely it's going to crystallize, especially if you're dehydrated. So the two things that are very important: hydration, adequate hydration, and by that you have to be drinking at least 1 liter of water a day, possibly 2 liters of water a day, up to 60 ounces a day, or about half your body weight in ounces, and eating adequate amounts of fat to cause the gallbladder to do its job. All right, just further holistic information about gallbladder function.